right, finally today, if your child gets hurt during a game, or maybe you take a fall on the ice this winter, did you know there's an orthopedic urgent care that you can go to get same-day care? It's called Advanced Orthopedics New England, and the doctors at the Bloomfield office see injuries all day long. Take a look.
Seventh grader Nathan landed himself in Advanced Orthopedics New England after landing on his hand over the weekend.
So we were camping this weekend, and he was one of the volunteers in the haunted house, and I guess his foot got caught and he fell, and he landed down on his hand. So he thinks he broke it, but we'll see.
Nathan didn't have an appointment. Mom Audrey brought him here because it's not only a doctor's office, but also an urgent care.
Like most orthopedic practices, you can call and get an appointment and show up. We also have an urgent care here in the Bloomfield office where you can come on the same day. You can either call ahead or just show up to be evaluated either by an orthopedic physician or a mid-level practitioner and get strictly orthopedic care.
Orthopedic surgeon Dr. Amanda Fantry tells us this time of year she sees a lot of sports injuries. Kids ages 6 and up through adults can come here to the Bloomfield office for urgent care.
Soccer players at this time of season, right, a lot of sprained ankles, ankle fractures, people who injure their foot playing basketball or football or soccer, kicking a ball, twisting injuries. So we see a lot of those in the fall. As it gets into the winter, there's a lot of falls on ice, obviously. Haunted house?
Yeah.
Okay, and what did you do?
I fell.
Directly onto your hand?
Basically, yeah.
How about in here? Right there? Okay, how about up here? Not as much. Right in here?
Yeah.
Okay. How about down here? That hurts. Is that the worst? Okay. No pain along here?
No.
Nathan gets an x-ray right away so Dr. Fantry can get a first-hand look at what's going on.
So patients who come in through the urgent care or come to be evaluated, we have x-ray here. Often patients feel like they need to go get an x-ray somewhere else first and bring it to us, but they don't. We can accommodate all x-rays here, and then that allows the provider to see your x-rays in real time. As everything is digital now, you're not waiting for films to print and have to hang them up in a light room, and it's very fast, and we can see you right after your x-rays.
Dr. Fantry examines Nathan's x-rays.
I don't see any obvious fractures or anything that's broken, okay? Sometimes when you have an injury that especially hurts down here, you can have an injury to a bone that doesn't show up right away, okay? So what we're going to do today is put you into a kind of splint, okay, and have you come back in a week or so and get new x-rays of your hand and see one of our hand surgeons.
A nurse brings in the splint and fits it to Nathan's hand, and he's ready to get back to his day. Good news for him and for his busy working mom.
I'm a bus driver, so it's hard for me to get certain doctor's office visits at certain times that I'm available, and being able to come here and still going back to work and not have to lose any time is great. I don't have to wait a few days to see if he actually did break it or if it's just a sprain, and he can go on back to school.
And that's the goal here at Advanced Orthopedics New England, the best orthopedic care with a treatment plan made just for you.
You can come here and be seen that day, evaluated that day, and be given a treatment plan as opposed to be put into a splint and told, oh, you have to see someone else for your ultimate treatment plan. So it's really great patient care and sort of ensures that you're getting the best orthopedic care we can provide from the beginning of your injury to the end.
Restoring quality of life in patients who want to be active and do the things they love is what Dr. Fantry says is the most rewarding part of her job.
It doesn't matter if you're a marathon runner or simply trying to take a walk around the block with your spouse, but it's our job to meet each patient, find out their story, what drives them, and what we can get them back to.
All right, for the address and hours, head to ctortho.com and click on Urgent Care. All right, we're back in the toy